If you nurse your baby for a few days after birth, you provide him with a healthy dose of colostrum, often called the baby's first vaccine. Colostrum is the sticky yellowish fluid that your breasts produce right after birth, before your milk comes in. Your body starts colostrum production during the last few months of your pregnancy as it prepares your breasts for lactation. Some moms are able to express drops of colostrum before they give birth, and small amounts may even leak out enough for moms to notice it on their clothes. Colostrum is highly concentrated, and is easy for the newborn's immature system to digest. Its main function is to protect the newborn from infection by coating the baby's intestinal tract and acting as a barrier to prevent the invasion of harmful bacteria. It protects your baby from illnesses that you have been exposed to, as well as illnesses that he may be exposed to. It also provides important nutrients, which is especially important for babies who are sick or premature. Colostrum functions as a laxative, helping clean out meconium, the dark greenish /black tarry stool that the baby's intestines form before birth, helping reduce the incidence of jaundice in the newborn baby. Sometime between the 2nd and 5th day after your baby is born, your milk will change from colostrum to transitional milk, which is thinner and more plentiful. This milk also contains important antibodies, which will continue to protect your baby for as long as he nurses. After about the 10th to 14th day, the colostrum is gone, but the mature milk will continue to produce antibodies, just not as concentrated as the colostrum. The protein in breast milk is much easier to digest than the protein in cow's milk or formula, making your baby less likely to suffer from digestive problems such as gasiness, rashes, and colic. Breastfeeding during these early days is helpful for you as well as your baby. Breastfeeding helps you develop a special closeness as you get to know this new little person who has entered your life, and also helps your body recover from childbirth more quickly by releasing hormones that contract your uterus and reduce postpartum bleeding. The benefits of breastfeeding in the early days provide an excellent reason to nurse your baby as early and as frequently as possible after birth, even if you feel that you can only do it for a short period of time. Many new mothers wonder how long they should breastfeed their baby. While the American Academy of Pediatrics recommends nursing for at least the first year of life, this may not be a realistic goal for all mothers. It is important to know that even if you only nurse your baby for a few weeks or even a few days, you will both receive many important benefits from the nursing relationship. Remember that you can always quit nursing at any time, but only if you give it a chance and see how things go. Reduced ear infections. Sure. Lower risk for yup. Bump in IQ. Sure. Breastfeeding your baby brings all these benefits plus a whole lot more. 1. A healthier baby. The incidences of pneumonia, viruses are reduced among breastfed babies, says infant nutrition expert Ruth Lawrence, MD, a professor of pediatrics and OB/GYN at the University of Rochester School of Medicine and Dentistry in Rochester, NY, and the author of Breastfeeding, a guide for the medical profession, Elsevier Mosby. Gastrointestinal infections like diarrhea, which can be devastating, especially in developing countries, are also less common. 2. Long-term protection. 2. Breastfeed your baby and you reduce his risk of developing chronic conditions, such as type I diabetes, celiac disease and Crohn's disease. 3. Stronger bones. According to Lawrence, who breastfeed have a lower risk of postmenopausal osteoporosis. When a woman is pregnant and lactating, her body absorbs calcium much more efficiently, she explains. So while some bones, particularly those in the spine and hips, may be a bit less dense at weaning, 6 months later, they are more dense than before pregnancy. 4. Lower SIDS risk. Breastfeeding lowers your baby's risk of sudden infant death syndrome by about half. 5. Fewer problems with weight. It's more likely that neither of you will become obese if you breastfeed him. 6. A calorie incinerator. You may have heard that nursing burns up to 500 calories a day. And that's almost right. Breast milk contains 20 calories per ounce, Lawrence explains. If you feed your baby 20 ounces a day, that's 400 calories you've swept out of your body. 7. It's good for the earth. Dairy cows, which are raised in part to make infant formula, are a significant contributor to global warming. Their belching, manure and flatulence, really, spew enormous amounts of methane, a harmful greenhouse gas, into the atmosphere. 8. Better healing post-delivery. The oxytocin released when your baby nurses helps your uterus contract, reducing post-delivery blood loss. Plus, breastfeeding will help your uterus return to its normal size more quickly, at about 6 weeks postpartum, compared with 10 weeks if you don't breastfeed. 9. Less risk of cancer. Breastfeeding can decrease your baby's risk of some childhood cancers. And you'll have a lower risk of premenopausal breast cancer and ovarian cancer, an often deadly disease that's on the rise. 10. An unmatched feeling of power. It's empowering as a new mother to see your baby grow and thrive on your breast milk alone, Lawrence says. 11. A custom-made supply. Formula isn't able to change its constitution, but your breast milk morphs to meet your baby's changing needs. Colostrum, the pre-milk that comes in after you deliver, is chock full of antibodies to protect your newborn baby. It's also higher in protein and lower in sugar than full milk, so even a small amount can hold off your baby's hunger, says Heather Kelly, an international board-certified lactation consultant in New York City and a member of the Bravado Breastfeeding Information Council's advisory board. When your full milk comes in, usually 3 to 4 days after delivery, it is higher in both sugar and volume than colostrum, again, just what your baby requires. He needs a lot of calories and frequent feedings to fuel his rapid growth, Kelly explains. Your mature milk is designed to be digested quickly, so he'll eat often. 12. More effective vaccines. Research shows that breastfed babies have a better antibody response to vaccines than formula-fed babies. 13. A menstruation vacation. Breastfeeding your baby around the clock, no bottles or formula, will delay ovulation, which means delayed menstruation. Breastfeeding causes the release of prolactin, which keeps estrogen and progesterone at bay so ovulation isn't triggered, Kelly explains. When your prolactin levels drop, those two hormones can kick back in, which means ovulation, and, hence, menstruation, occurs. Even if you do breastfeed exclusively, your prolactin levels will eventually drop over the course of several months. Many moms who solely nurse will see their periods return between 6 and 8 months after delivery, Kelly adds, others don't for a full year. 14. Less time off work. Your baby will be ill less often, so that means fewer sick days for you. 15. It's cheap. According to Lane Lech League International, the cost of formula can range anywhere from $134 to $491 per month. That's $1,608 to $5,892 in 1 year. 16. A great way to learn about your baby. You have to read your baby's satiety cues a little better, because unlike with a bottle, you can't see how much he's eaten, Kelly says. You have to rely on your own instincts and your baby's behavior to know when your baby is full. 17. You can stash the condoms, for now. Breastfeeding can be 98% to 99% effective as a post-baby birth control option if a few guidelines are followed. Your period must not have resumed. You must breastfeed at least every 4 hours around the clock. You must not give your baby any pacifiers.